Andrew Herdman, welcome to In Conversation.
My pleasure.
Is the fear factor larger now than it was during the SARS period?
No, my personal recollection of SARS is that it was very frightening, particularly in the most affected areas, and it was definitely a global story. So we saw the same effects. This time, the number of cases and the number of deaths has climbed rapidly, but of course you have to put it in proportion. The question is the scale. So in terms of I don't panic, it's concern, it's anxiety, and people change their behavior, and it affects businesses, it affects ripples through society, and changes people's normal way of life and supplies of various things and so on. So there's a certain disruptive effect. It's very important to get back to the basics of what are the advice to the traveling public, what's the advice to the public? And it's very simple things, which is hand washing, avoiding contamination, from your hands to your nose, mouth, or eyes. And this question of social distancing and the question of avoiding large gatherings and so on. So in that sense, travel's no different to other forms of public gathering. Aircraft themselves have very good filtration systems, air circulation systems and filtering systems. So, being on board an aircraft is no different to being, in some other conveyance or in a meeting in a room or something like that. So there's no particular focus on the risks of traveling.
Let's come back to that. A lot of people will say, all right, being in a plane though does feel rather different from, let's say, walking into an MRT, into a subway tram car. It does feel as if you're more boxed in, and therefore, if there is somebody in there who might be infectious, won't it be more dangerous?
As I say, the filtering systems and the air circulation systems on an aircraft are, comparable to an operating theatre in a hospital in terms of the quality of the filters and the way in which the circulation of the air takes place. You do not. There have been studies of, the extent to which diseases of any kind transmission in an aircraft setting. So those fears are unfounded, but people do have that anxiety. One of the issues, of course, is you can't get off. You can't say halfway through. But you have to
that person coughs. I can't get up and say, hey, I want to get off the plane now.
Right. So you have to remember that flying is extraordinarily safe. It's one of the safest places you can be. And that applies to all forms of, threats and risks and so on. So it's a very safe environment. And from a health perspective, it's also safe. But people, are anxious. That's one of the factors that people weigh. But it's more to do with what are they going to find when they get to the destination, or the travel restrictions. The person may themselves feel confident, comfortable, but what if they face travel restrictions, having to self-quarantine when they return? So that chokes off demand. Travel's not banned, flights are not banned, but nobody wants to go because nobody wants to have to self-quarantine for 14 days.
Some of the fears may be fairly real and tangible. Look at the leadership summit that you were supposed to attend here in Singapore. That's been cancelled.
The summit was cancelled, I think, because a number of the people who were due to speak said they were too busy addressing, the challenges from the perspective of their airlines or whatever organizations.
Even after some of the cases that we've had in Singapore, where it was clearly a meeting in which the various persons were just in a conference room together, and they've now gone on to infect persons actually all over the world.
Well, this disease, like others, communicates, transmits very easily through close personal contact, and so that's a risk. But that's a risk we live with all the time in terms of, as I say, the common cold or flu and so on. So we have to look at it in perspective of what is the risk level realistically, what are the numbers, and that's why it's important to have published information.
Do you think that governments have been too restrictive about screening people, about travellers that they're willing to take in?
Well, it's interesting. The WHO are not recommending travel restrictions, and that's based on past experience. And also we learned from SARS and other events that arrival screening is not effective. Exit screening, there is a role for exit screening, preventing sick people traveling, preventing sick people from getting onto aircraft and other forms of transport. So there is a role for exit screening. The benefits of arrival screening are doubtful. That seems to be the wisdom of the experts. But of course, in a national government policy perspective, there's a temptation to a well-intentioned idea of trying to restrict entry. So you have temperature checks or questionnaires or what is your travel history and so on. But it's interesting we have this somewhat of a disconnect between what WHO is recommending and what many governments are doing. And particularly where you have very broad restrictions based on simply the passport you're carrying, or a very blanket requirement if you've been to any of these areas, and that might include the whole of China and a number of other countries. So it's doubtful whether there's any public health benefit to that. But of course governments are thinking of the readiness of their own health systems, the signals they're sending to their public, are they seen to be doing enough? So we've got to disentangle why politicians, they're human after all, do the things they do, and whether that's for a public health reason or whether it's politically driven. So I think we do need more dialogue involving governments. I think with the WHO, the aviation in the United Nations framework, ICAO represents the forum for discussing aviation. So good collaboration between ICAO, WHO, industry stakeholders and governments working multilaterally is important. And certainly some of the measures I would say are by nature overreactive. We need to be careful about that because the disruption caused is disproportionate to any public health benefit.
So you're saying that governments may be overreacting, airports may be overreacting or possibly not channeling their energies into the correct thing?
Well, airports learned, like airlines, and shared the lessons in the past, and the guidelines and agreed with WHO in recent years reflect those lessons. So what I've said about the benefits of exit screening, that's been applied. So Chinese airports have been doing that, a number of other airports and so on. So those lessons have been applied, but we still note that individual governments are tempted to take what they see as necessary measures. There is a requirement under the international health regulations that governments that are imposing travel restrictions have to inform WHO within 48 hours. And the WHO can question the benefits, the analysis in terms of the cost benefit, in terms of public health benefit, and what's the rationale. And they may ask, the WHO may ask states to reconsider. At the moment, it seems that many of the states have not yet satisfied that reporting obligation to WHO, and I think that needs to be followed up, and I think there needs to be more dialogue involving the experts in WHO and the national governments.
What about airlines? There are some of them who have imposed restrictions or even without restrictions saying they're cancelling flights, or without the government actually telling them to cancel flights.
Well, airlines are reactive. We do have procedures for handling communicable diseases, cabin hygiene, cabin cleaning, staff training, what to do in case of people found ill at airports or during flights and so on. So, airlines are prepared for all of that based on agreed international protocols. As to airlines cancelling flights, it's reactive. You may be told by the government you cannot fly to this country. Or you're asked to restrict capacity. But at the same time, public sentiment is being affected by what they hear, and demand falls off because of the uncertainty or the anxiety or even warnings against travel or against non-essential travel. So what we see is a mixture of airlines being forced to cancel, or simply saying there is no demand and we're going to cancel flights.
Nobody's booking flights.
Yeah, the number of people flying might fall by 20% or 50% or even higher. So we've seen capacity cutbacks in China of 50%, 70% in and out as well. So it's the fact that flights are flying with very light loads. There simply isn't the demand. But in some cases there might be demand, but it's choked off because the government says we're not allowing flights between two countries. But that contradicts, as I said, international agreements. So it's important, I think, to keep linkages there. we recognise that passengers have the right to decide whether or not they're going to travel, but I think we need to give the passengers the information rather than simply say you can't fly to these places or you can't fly if you've got this passport and so on. We have to, apply some rationality to that process.
Do you feel from a business perspective that the worst is yet to come? I mean, we were already seeing some fairly negative impacts from the trade war slowing down, but this is really a double whammy.
Well, airlines are used to operational disruptions of one kind or another and the fluctuations in demand. So there's a certain resilience and operational resilience. But by the same token, airlines are in a very competitive market. And even in good years, profits are thin. It's highly competitive. That benefits consumers in terms of affordable airfares and choice of products and services. But it does mean that when difficult times strike for whatever reason, airlines feel the pressure.
Is this going to be as bad as SARS? When SARS was at its height, Singapore Airlines was losing $6 million every single day.
Difficult to say at this stage, and that was almost 20 years ago. I was in Hong Kong at the time, so had, like others, had some frontline experience. That episode lasted about 3 to 6 months, and then there was a very strong recovery. But that was never clear during the event, and at this stage we're in the very early stages of this outbreak, and it's unpredictable. So that's the big unknown. But it is already having a very significant impact on demand. People are unwilling to travel, or they're prevented from traveling because of governments imposing travel restriction. So we're seeing airlines cutting back capacity within China, to and from China, quite dramatically, and demand has also fallen off very sharply. So it's having a very significant impact, and obviously that affects the cash flow of airlines, and airlines having to take steps accordingly. The numbers are still climbing, particularly in China, and the question is, will we see the numbers peaking and then tapering off? And it's not clear why viruses or other infectious diseases behave in that way, and each case is different. So the medical professionals are very reluctant to try and forecast. They have modeling capabilities, but we have to recognize that nobody really knows. So we have to take it as it comes, and it'll probably get worse before it gets better.
Coming back to this thing about long-term recovery though, I mean, is this unpleasant, very serious, but still in the long term something that Asia-Pac Airlines are going to recover from?
Yes, I have every confidence. If we look back at SARS, it was 3 to 6 months. If we look back at other events with swine flu or the MERS, Middle East Respiratory Syndrome, that showed a similar pattern, that the outbreak spreads and then it's contained, or it dissipates and then becomes dormant, or it becomes background or disappears altogether. But again, there's no guarantee. We're used to having viruses for the common cold circulating. We're used to normal flu viruses circulating. But of course, we're used to those, and although they do cause some loss of life, the level of fear is calibrated according to past experience. Whereas this is unknown. It's in the frightening phase. It's a new novel virus, and people are rightly concerned.
So what are the immediate losses that Asia-Pacific Airlines are going to suffer from?
Well, business turns down very markedly on these particular routes, and that can be quite significant because Chinese travelers are a big part of the market, much larger a proportion than they were, say, 20 years ago. So you get an immediate cash flow impact. Now you can alleviate some of that by cutting flights, and you don't have to spend fuel and so on and so forth. So the question is, what's the cash losses? I'm sure they'll be measured in the billions of dollars, but this is a very large industry. So the question if airlines have to weather that cash flow hit and then get through it, and then things will pick up. But overall, bottom line effect, this is a very competitive. Margins are very thin. In a good year, airlines are making profit margins of maybe 4% or even less. Some airlines less than that, some airlines slightly better. So to go from profit to loss is is finely judged. So it's possible that a number of airlines will be pushed into losses, but they'll come through it.
So some airlines will actually go into the red?
Yes, and some airlines are already in the red, and some airlines that are profitable will be pushed into losses.
Would you hazard a guess of how many of your members might be affected?
No, I think it's very difficult to quantify. But if you look at the magnitude of the cuts in capacity and the fall off in loads, it's easy to roughly calculate, what the revenue shortfall is going to be. Which is why you see airlines cutting flights, because if people aren't flying, there's no point flying empty airplanes and paying for fuel and so on. It's also interesting, jet fuel demand at the end of January in China was down 25%. As a signal of just how much capacity has been cut. And I think the capacity cuts since then have been even more significant. So that cuts the costs as the revenues shrink and the overall, but there's no escaping the fact that you're going to swing into, you're losing money on those routes. Now you may still be making money elsewhere, but overall it's going to be a period of high uncertainty and financial pressure. But of course airlines have significant resources, not profits, but significant financial resources. And so they will weather the storm.
The bounce back, as you mentioned before, during SARS, it lasted for 3 to 6 months, but we actually did see quite a quick recovery, even on the broad economy, not just to do with the airlines. Are we going to see the same here, that this is going to be an individual black swan event?
Yeah, past experience, if you look at the ones I mentioned of SARS, MERS, swine flu, avian flu, you see a bell curve shape with a 3 to 6 months typically. And just as things deteriorate very rapidly as you get into it, once it passes, the peak passes, and then it dissipates, you see a recovery in confidence and a recovery in demand. And you've also got some pent-up demand. And so not just aviation, air travel, but other aspects of life. So you do see a recovery, and hopefully we'll see a similar thing. But we shouldn't prejudge whether the trajectory is going to be the same. We don't know when it's going to peak. We don't know what the duration will be. The other thing is the disruption here. Travel and tourism is very badly affected, retail, hotels, as well as air travel. But it's also having a ripple effect on supply chains. We see that from the air cargo side. And that wider disruption, there's a question of how quickly that will recover as well. So when you say what is the overall impact, it's we have to look at the knock-on effect on supply chains. And in a globalized world, you see an announcement by a car manufacturer in Europe saying they're concerned about supply chain from components coming from China and so on. So we have to look at it from the point of view of the impact can be quite significant, but the market will rebound and people will adapt. So I'm confident, and air travel will recover, and Asian airlines will come through this. But it is very challenging, and it's very uncertain, and it's financially stressful, and there'll be a lot of pressure to reduce costs, and that may include asking staff to take unpaid leave or even layoffs. So airlines, mindful of the fact that there will be a recovery and need to be ready for that, will try to preserve the workforce, which is why you see some airlines moving towards unpaid leave, because that's a temporary measure in anticipation of the fact that as and when we get a rebound, we'll need the staff.
So you're saying, though, that tourism should be able to come back to its old levels. People will not be worried and then generally start to travel less overall, but in the long-term tourism will come back to the levels it was at before?
No, people love to travel, and we've seen the growth in demand. This industry doubles in size every 15 years and more quickly than that in Asia. So I've no doubt we'll see a recovery, not just to the levels of before, but a resumption of growth. So the longer term outlook is still very positive. We're still building new infrastructure for future growth. And as and when the upturn comes, this industry is very adept at recovering. As to the public, the past evidence is that the public recovers confidence very quickly and makes up for lost ground, as it were, and you should see a strong recovery. But we're not at that stage. We have to focus in terms of reacting to the situation as it evolves, and as it worsens, we have to be prepared for that and act accordingly.
And a personal question, any particular steps that you take when you get onto a plane now?
Just the basics, hand washing, personal hygiene, and when you're touching things and so on. So those are very simple things. But I say, flying is extraordinarily safe, and that remains the case.
Andrew Herdman, thank you very much for being on In Conversation.
Thank you.